New tonight, the Centers for Disease Control altering its recommendations for some popular childhood vaccines. It's not just the flu or COVID-19 shots, but also hepatitis A and B.
Now, some parents are welcoming this change, but physicians are expressing concern. There is some confusion tonight about whether insurance companies will still even cover these vaccines. Fox 17 News' Karrie Aguilar live in North Nashville after digging into the insurance issue.
Scott, health officials tell me that the children vaccines that are no longer recommended by the CDC will be covered by insurance. However, the argument boils down to parents making informed choices and access to those vaccines at places like pharmacies. Tuesday, confusion swirled around what the CDC no longer recommending certain vaccines for children means. Karrie Marren is a parent.
It's complicated, and I think a lot of parents might still be a little confused.
Monday, the Department of Health and Human Services announced new guidelines such as immunizations recommended for certain high-risk groups and immunizations based on shared clinical decision-making, meaning physicians and parents would still discuss the vaccine for the child. This includes the hepatitis A and B shot.
I think really what's important is for each individual parent to really authentically talk with their pediatrician.
The Department of Health and Human Services claims the COVID-19 mandate led to the distrust of public health agencies and in turn led to a decline in childhood vaccination rates. The agency says it is changing the recommendations of child vaccines to regain trust and increase vaccination rates. Vanderbilt pediatric infectious disease professor Buddy Creech argues the opposite.
One of the strongest ways to ensure that vaccine uptake stays strong in a community is the strength and confidence of that recommendation from pediatricians.
Creech tells me the no longer recommended vaccines are not mandated and are still available. Federal health officials say those vaccines are covered by insurance. The AHIP, the National Association for Health Insurance Companies, also confirms that. Creech tells me the problem is access to the vaccines, like pharmacies, because doctors might be the only ones qualified to approve the shots.
It may not be as easy to give those vaccines without documenting certain elements.
Creech tells me that it's unclear if pharmacies will have the ability to give out those no longer recommended vaccines without doctor approval. That's to be seen. For more information on these changes, you could head to our website at fox17.com. Reporting live in North Nashville, Karrie Aguilar, Fox 17 News, your Code Red station.